See, I'm reading. See what happens when I'm reading. Get it together, girl. Get it together. I'm reading and then I looked over like, wait, that's me. What did I do? Pay attention. Pay attention. Good morning. Good
Good
morning.
morning.
Good morning, everybody. Okay, let me get this because it's gonna drive me crazy. Crazy. How are you? How was your week?
It was good. How about you?
It was great. It was great. It was great, especially after I talk a little bit about one of our church announcements, but it was so great.
Okay.
I was just grinning from ear to ear.
All right.
I love it. I love it. All right. All right. Let's see. Alonda, I hope I'm saying your name right. Happy Saturday. Welcome. Welcome. She wants to learn more about medical billing and where we can take a class. We'll talk about that later. Good morning, Crafty Coder. Good morning, Tanika. Um, all right, good morning, everybody. How was your week, sir?
It was actually it went by pretty quickly to me, it seemed like.
This month, it is the
Yeah.
15th. I'm like, what? Slow down. I'm nervous. Slow down. I can't take the heat. Slow down. Oh.
Well, the highlight of my week was I got excused from jury duty.
Did you said you thought you might?
I was so glad to get that text and email.
Did you do a happy dance?
Almost.
I love it. I love it. All right, all right. Well, let's get this party started because this is a lot. Okay, so welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, and entrepreneurship, and the weather, and jury duty, and all of the things, but primarily the revenue cycle at large. So as you come in, don't forget to hit the thumbs up or like button. Um, yeah, they've done some things with um, Facebook that I got to go in and tweak. There was a big announcement with StreamYard and Facebook, so I got to go and see what the what. So our Facebook people aren't here, but we're streaming on Twitter or X. I'm sorry, on X. So I I replaced those two. So we'll see what happens with that. Maybe we'll get in front of some interesting folks, and
There you go.
they may have an opinion one way or the other. All right. So I am Clarice Warner. If you don't know, I am the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. So let me ask you, do you know what it takes to be a certified marketable medical coder? Hmm. Well, if you don't, before I introduce my co host, let me share with you information on a free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Yes. You just tickled. All right, all right. So, if you are interested in getting more information on the 5 steps to become a certified marketable medical coder, then check out the video description for the link. So joining me today is my illustrious co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been a nurse for over 30 years. And in 2014, I left the bedside and started working in HIM. During the pandemic in 2020, I created a company called the Coding Nurse LLC, where I help nurses and other healthcare professionals with a clinical background transition into the wonderful world of HIM.
And how is that going? Mm-hmm.
It's coming along quite nicely, I have to say.
Coming along quite nicely. Love it. Love it.
Because what I've also realized is that my company has also become a placement agency. Because can I tell you, I I don't know, like,
Well, with all that information you gave in the meeting after the meeting last week, I bet it has.
but it's like almost like people really don't know how to look for a job. It's like they're just it's lost on them.
That was a whole class, though. I mean, you know what? I think that might be something we should do in one of the meetings after the meeting. It's just like, here's an ad. Let's walk through, you know, the information, the keywords you should have if you're we should probably do one of those. But you dropped y'all dropped some gems last week, some gems. So if you missed it, you missed it. But you dropped some gems on being out here in these streets looking for medical coding or any position really. I mean, this is transferable to pretty much any industry. You just have to know um, how to do it, the how to, and
Because
y'all were
as we've come a long way from looking at the classifieds in the Sunday paper.
sir. And getting print on your fingers like
Yes.
and circling this and walking around with papers and sir, we've come a long way. um and I don't think they're ever going back, so
No.
you got to get in where you fit in and learn this technology, learn how to um maneuver the technology so that you can be in the fray, so that how to get your resume through the algorithms and the foolishness that happens from the HR perspective, and so that you can be successful. So, absolutely, yeah. I was thinking about that earlier this week. Like they were doing the thing, just breaking it down, and then making sure you get it in Spanish. I ain't gonna let that go.
Oh, I had my first class last Sunday.
I, did you? Wow.
It was good. It was good.
Okay. Bless
And
your
he's
heart.
from Ohio.
Oh, well, look at that.
Yeah.
We are coming just around full circle everywhere we go.
Yeah.
That's what's up. Now, is he a native Spanish speaking
No,
person?
he's African American from he lives in Columbus,
Oh,
and he
absolutely.
he went to Ohio State. He has a bachelor's in Spanish and a master's in foreign language education, and he's
Nice.
been teaching I think for like 15 years.
Nice. Nice. I like that. Okay. He saw the same niche you did, huh? Like y'all playing. Follow the trends. Follow what's going on in the world. It'll
Mhm.
tell you a lot. Tell you a lot. So before we jump in, let me remind you that you can join in and add to the conversation. So don't be shy. Your opinion matters and is always welcomed here. So just use the chat. If you have a question, the only thing we ask is that you put a Q first so that we know it's a question and we don't miss it. All right, all right. So for those who are just joining us, welcome, or watching the replay, welcome. Today we are talking code red. I feel like I need a siren thing. Code red. Medical coders under siege by AI and outsourcing. I know that was a bit extra, but I could resist it after I saw this. I saw and heard all the stuff I saw and heard this week. Like, really? This what we doing? Help me, help me understand. But anyway, but first, our church announcements. Let's get into them. Do, 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 do. I feel like I need my church hat too. Tim, I mess y'all up one day. I'm gonna come down here with my full church hat. Like, what? I never need gloves. I could never find them. But
Oh,
I know where the church hats are.
a church hat and gloves.
Yeah. She like, she is in full character today. All right. All right. All right. First things first. Uh-oh, there go the usher hand. Yes, yes. Better play that organ, sir. Or ma'am. I don't know. We got a lady at our church. She is mean on that organ. She don't be playing.
All right.
And she will kick her shoes off and be on the thing. Yes. I said, you better get it. I love it. You're like, yeah, I guess they hadn't intended for the ladies that had their heels on playing the organ. And I guess she feel like, hey, let me just kick all of this off. I got something for you.
Exactly.
All right. So, okay. My first announcement. Yes, this is the church announcement that just had me tickled all week. So we talked a little bit about
Turn the
I'm turning it
background.
down.
Yeah.
Okay. So we talked about earlier the Black nursing documentary, Breaking the Silence, that was brought to you by Black Women Cultivating Change, an organization that I am affiliated with. I sit on their board. And we let you know that there's going to be a showing hosted by the Black Women Cultivating Change and the Black Nurse Network in Philadelphia on August the 2nd from 6 to 9 p.m. That's a Friday. But the big thing was, one of the biggest things was, I don't know if you can see my little pointer. Does it go over? Yeah. Look at this right here. We got the sponsor in there, the coding nurse. Yes. Wait, I wonder if I can even blow it up. Hold up. See, this is what happened when you There we go. One of the sponsors is the coding nurse. I was so excited when I finally saw it. Like, look here, look at here. Congratulations, sir.
Thank you.
I am very excited about all of those things. Yes, yes, yes. And so one of the things we want to do, I said I want to remove. Okay, one of the things we want to do as part of this is to actually have our Saturday morning tea live on August 3rd. So I am in the process of pulling all of that together. I will send you, I'll definitely let the Patreon know. You all will get first dibs on all of the things, where we will be, what's going on, if you want to join us, all of the things. So be on the lookout for that. But we're going to try this again. Part 2. Oh, she's like, I got my flight. She ready. She's clapping. Yay. Congratulations. So, yeah, that's what we're going to do. The other thing. So I got all of these. I was was busy last week, and I meant to show these last week, but I didn't get a chance to. So I got an award. I got two awards last week.
Oh,
Here's the first one. It is um, the More to Do, the Regional Police Accountability and Public Safety Conference presents the Manette Cooper Problem Solving Award. Manette Cooper was a city council member here in Cincinnati that was standing 10 toes down on business before that was even a thing. Let me tell you, she she um she didn't play. So this is to those who perform outstanding work, service, and problem solving in the community. So I got this award for being the chair of the Citizens Complaint Authority here in Cincinnati. So that was one award I got. Yay!
congratulations.
Thank you. And then I got another award that is so pretty, near and dear to my heart. This is also a community service award. Woo, it says Community Service 25-year Parent Star to Clarice Warner from the High Steppers 2024 organization. High Steppers is a local dance and drill organization that is near and dear to my heart because both of my girls was on the dance team for years. Well, one of them, I tease her all the time. Look, she only made it to the pictures. Once they took pictures, she was like, "I'm out."
Well,
That was the oldest. She was like, "No, this is not for me. I'm out." But the youngest stayed on, and uh, for many, many years. And I still help out where I can, when I can, with the organization and their co-founder and director, Miss Miss Kelly, who is doing all of the things. So yes, so those are the two awards I got last week. So I was excited about that. Out here doing some other things in these streets. I'm trying. All right. um. So let's get to the business of the day, shall we?
oh,
Oh,
what?
you got a church announcement?
Can you
Go ahead.
believe it?
Well, wait. Look, when you said "ooh," I said, "Hold up, wait a minute, stop the presses." He's about to say something.
It's just going to be a light one because we might have to delve into it more in the meeting after the meeting.
Oh,
But
oh,
I'm
okay.
not. This is you because maybe I think in the meeting after the meeting you have referenced a company. I'm not going to say the name, but
Okay.
their competitor was in the news last year. I was doing some snooping, and last October, Fresenius, who they operate dialysis centers nationwide,
Mm-hmm.
they um, they were sued by the attorney generals in New York and New Jersey for false claims in October of 2023. So what they did, part of what they released was they were performing unnecessary procedures.
Interesting.
And one man, a 41-year-old man, had 27 angioplasties performed in from May 2012 to May 2018. And another patient had 15 unnecessary angioplasties in that same time frame.
Wow. Wow. That's what I'm looking like. Wow. She's like 27. Wow.
Hmm.
That's abuse. That's criminal.
Hmm.
They should have got more than just false claim. That's criminal. Wow. Interesting. Yeah, we will dive in a little further in the after meeting because I got some information from all of those things.
Okay. Because
Yeah.
as far as it being criminal, like the the attorney general can only do so much, but the medical board can come after them as well.
Exactly. And should.
Hmm.
And they really should. Because again, that's criminal. Putting people under all of that. Oh. Mm-mm-mm. Bless their hearts. All right, all right. Any any of our folks in uh with us have any? I'm checking to see if y'all got any announcements. She said all the letters. FWA. With emphasis on the A. Like, this is crazy. Crazy. All right, all right. Well, let the tea spilling begin, shall we? That was the one thing I was looking around like something is missing off my desk, and lo and behold, it was my tea. I had to go get it. Said no tea. We gotta have a tea. We gotta have a tea. All right. So this week, did anybody have an opportunity to listen to the AHIMA town hall? Let's start
Yeah,
there.
I forgot all about it.
Oh my god. So yeah, it was a whole thing. It was a whole the one thing that tickled me, I think what tickled me the most was they used StreamYard to do it. I said, well, look at here. We all in the same good company. Same good company. Um, but one of the things that they talked about um was a couple of things. You know, this was an attempt by AHIMA to connect more with their members, to be transparent, provide transparent information, conversations, um, all of the things. Well, one of the things I think that made me happy um, regarding the town hall meeting was, and it was so difficult. There were a lot of people on it. I think it was over 1,000 people, I believe, that was actually on at different points or various points. Last time I looked, it was like 1,000 some people on the line or on the in the meeting. Um, but so so trying to keep up with the comments, because you know the comments is where it's at. They can say whatever they want to, but the comments, folks gonna comment. The comments was commenting. Um, and someone talked about the customer service with AHIMA. Like, what is going on with customer service? You know, I've had like basic questions that I needed answers to, and the people had they didn't know who we were, what was going on. They couldn't answer any questions. Well, lo and behold, you know, that customer service was uh, outsourced, probably offshore, but at least outsourced. So the people would have no idea about the organization, um, being able to answer questions, transferring folks all over the place. It was like a nightmare. It was horrible. So one thing that they did announce was that, and the new CEO, Dr. Kevin, was very highly animated about the announcement that, you know, we should be in a position to give whatever information or problem solving for our members, um, in the as a first line person. So no more offshoring. All of the calls, they're bringing that whole call center, bringing all of that back in house. And so I don't know if it has already started, but coming soon, they will be answering their their own questions. She said, "Go figure." They will be answering their own questions and doing all the things as it relates to AHIMA. So that was a positive, and you know, people appreciated that. They thanked them for that. Um, of course, they talked about the uh, the fighting the 40 and all of the mess with that. But the other thing that came from that, so they talked about. Oh, yeah, I wrote it down. I didn't bring it over here. They talked about a process. So anytime there's some sort of this was really a lesson for them, and they took it as such because it was horrible. The communication to the communication from one entity to the board to the leadership was bad, and then you forcing it to your members, like no one had a say, no one had an opportunity to weigh in. It was like, this is what's gonna happen, get ready, um roll with or get rolled over, pretty much. and they admitted that it was horrible. Kevin has been apologizing for it forever. Ever since, and it actually happened before he got in, but it was kind of like one of his first objectives is to right this ship because it was bad. Well, one of the things that they learned in this was that they wanted to have a process where if there's something that is going to impact the members um, substantially, then other folks, you can't just make those decisions in a silo. Other folks need to weigh in. So ultimately, the board, AHEMA leadership, and the members, so they will have similar to what CMS has when they do a proposal. So there will be a proposal of sorts for whatever the changes may be, what policy changes or what have you, and then there will be like a 60-day uh, comment period. So then you can make comments, weigh in, you like it, you don't, da 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 da. Hopefully and prayerfully, they will take the comments and use them as they did this time, because they actually, I mean, somebody was responsible. Several people actually were responsible for pulling out and making sure, because all of the comments kind of went into like a FAQ, so making sure that the comments were reviewed, and discussed and answered, and questions answered, and all of those things, and so they want to do that for any large policy changes that impact members. And I thought that was an excellent thing for them to do. I thought, well, look at here, they're doing some things. Sorry.
I just
I know it's 150 years late. However, better late than never. Um, Particularly with all of the additional um, transition and things that are happening. Um, I think there was one other thing that I wanted to mention. The HC Pro. So they don't like to be called HIC Pro. They like to be called HC Pro, and they wanted folks to know that off the bat. Please don't call us that. We are HC Pro. So HC Pro.
Okay.
Uh, like, don't mess up our name. Um, HC Pro is also part of that 40%. So if you are receiving, because they are a part of AHEMA, so if you are receiving any type of course material or training through HC Pro, then that's also part of it. Last thing I'll say that was kind of amazing to me was, and they've mentioned this. This just shows me how big or how large the disconnect is between AHEMA and even some of the state um, players. Like years ago, AHEMA changed from being um, component state associations to just component associations for a couple of reasons. One, not every state had an association, and some of them were combined, and some of them were technically, I guess, kind of regional, if you will. So they got rid of the state part in the bylaws a long time ago. So in the again, this is where the fun was in the comments. Like, they're, you have to see your CAs, and so are the CAs part of it? Well, what is a CA, or who's a CA? Well, what is or you mean the state? I mean, it was a whole back and forth, and I was like, the people don't know. So again, I think there is some mishap or misstep that can be corrected. Again, making sure your members understand and know who you are, and who, at least, what the role of the state is, and what they're called, and local, and understanding like the hierarchy. Because then a switch was, well, what about the regional, or what about the local? Are they part of it? Well, technically your local is not affiliated with the national. They're affiliated with the state. So it's a whole hierarchy thing there, and folks may or may not know that. So I think there is still an opportunity for additional communications and education to the members regarding their organization, which then falls to, well, we don't even know who the hell we are. How will anybody else know who we are? On a national level, and providing folks education about who we are, what we do, what skills we bring to the table, and all of those things. So, Mr. Jesse, I'll stop there.
Um, the whole state association thing, like, I mean, honestly, like that that's not my area. Like, I'm not, that doesn't do much for me. But I just think that as an organization, they really, well, at least he seems to be engaged. I can say that, but they really need to come up with a mission for the organization and how they're going to move their members forward in the future. Because, like we have, like I've talked about, like I just see the next big change is going to be data, and how AHIMA has not gotten in front of it, and how they have not provided a pathway for their people to transition into it. It's just, I just think that it is a huge missed opportunity. And what's going to end up happening is just like um, RNs have taken over CDI, RNs are going to take over data, and they're going to block out HIM people. And it's a huge missed opportunity for me, from what I see.
Hmm. I agree. I agree with that. So, shifting that to AI, I believe I heard at the conference last year that um, AHIMA as well as AAPC are both organizations have invested either directly or indirectly. I think most of them were direct though, into AI companies and AI organizations. Um, Very little information has been released about that. Like, the purpose of, is that contrary to particular, and I'm speaking solely about coding. Is that contrary to what's happening with coding? People are concerned about AI and their positions, and even off or outsourcing as well as offshoring and their positions, and what are their thoughts on that. So I think that too should be a conversation. But one of the things that came up when they were talking about AI is um, the thought or the belief that AI will assist with unnecessary coding tasks. And that just stuck with me. Like, what are these? Am I missing something? What are the unnecessary? What are the unnecessary coding tasks? I still don't know. So I was like, maybe I'll bring that to the Saturday morning tea. Let's, does anybody know what the unnecessary um, coding tasks are? I did kind of do a cursory some cursory research to see, well, what can I find, or what were they talking about, or what, I mean, again, am I missing something? What, who? And one of the things that I saw, wait a minute, was they didn't seem unnecessary to me at all. It seemed, I mean, coding is a whole process. Um, Done right, it's a great process, but it's a whole process that needs to happen. And some of the things that they were talking about related to this process, I was like, a coder needs to do that. Um why would you let the AI algorithm take over that portion of the process? Okay. Mr. Jesse, you can jump in at any time. I'm looking for my.
I'm with you, and everybody in the chat. Everybody, I don't think there's any unnecessary coding task. And if people have ever worked with AI, you'll because if you have to go and check and redo what they did, then they don't know how to do unnecessary coding tasks either.
I know. Wait a minute. Let me grab my other computer. Hold on.
Okay.
I was like, talk among yourselves, govern yourselves accordingly. All right. So let me pull this up because I was like,
So while you're pulling that up, Tanika had put in the chat, maybe AI will assist and the coder will review. I don't know. Well, that's what it has turned out to be, because you have to definitely check whatever AI does. You can't just assume that it's right, because a lot of times it's not.
so I found it said, okay, so to our point, coding, medical coding is a complex process that requires human expertise, critical thinking, and decision making skills. Um, but then it says while AI may not completely replace human coders, it could potentially eliminate or streamline some tasks, such as code assignment, which okay. Um, it says the AI systems can be trained to analyze medical records, including physician notes, lab results, and diagnostic information, and suggest appropriate medical codes based on established coding guidelines and rules. However, human oversight and validation would still be necessary to ensure accuracy and account for nuances or ambiguities in the documentation. You're going to always have a human when it comes to dealing with the documentation. Two, code validation and auditing. AI algorithms can be used to cross check assigned codes against coding rules, guidelines, and best practices, identifying potential errors or inconsistencies. This could help streamline the quality assurance process and reduce the time spent on manual auditing. I said, okay, all right. Code research and reference. AI powered search and retrieval systems could assist coders in quickly finding relevant coding rules, guidelines, and references, reducing the time spent on manual research. Okay. And then the last one was like repetitive tasks. AI could potentially automate certain repetitive tasks, such as extracting relevant information from structured data fields or updating coding software with the latest coding changes and updates. And so the update piece, I'm thinking like the charge master, maybe having something where, but some of this to me is still part of the coding process. Like you have to go in and check the rule and validate that the documentation supports what is necessary and what is needed for that particular diagnosis code to be used or procedure code to be used. So
Mhm.
I'm like, I don't know. She said, do do not ask Chat GPT to code sepsis in the hospital, please. I don't know if this is
Please.
where they trying to go with this. I don't know. So I'm still wanting someone to explain to me what the unnecessary tasks coding tasks are. I don't I don't know. I don't know.
I don't. I Well, this is again. This is where you have where AAPC and AHEMA are really acquiescent and letting science and technology get ahead of them, when they're supposed to be the gatekeepers of the profession. They really are, and they're not doing a good job. Because I'm not saying that there may not be a place for it, but they have been. Like they have been hyping up, because before they called it AI, it was called NLP. They've been doing NLP since 2015 that
Forever.
I know of.
Mm-hmm.
Exactly. So, and it's 2024 and they
Or
still haven't
what
gotten
is the assisted coding? um
Right, computer assisted coding.
computer assisted coding. I couldn't think what the first C was. But yeah, all of this stuff has been going on in the background. Or even when you're using an encoder and it makes suggestions or whatever, which are great, but as a code, you need to know sometimes those suggestions may not be right, or sometimes, the information that they're pulling, some of the suggestions may not be valid for that particular encounter. It may not be, it may be, oh, I think a lot of this, when we talked about, well, why are we always seeing these errors in these certain places? This may be why, particularly like, and I'm thinking, with cancer and history of cancer. Like if you see something and you spot this, but you don't, the algorithm or the AI system doesn't understand that there has to be active treatment going on in order for that cancer to be considered a cancer diagnosis today, where active treatment is happening, and all you see is cancer somewhere. You don't know. I mean, that patient could have a very lengthy history with that organization, so there may be numerous documents, and if, I know AI can kind of supposedly read it in a second, but just because you picked something up doesn't mean it's valid for today. And so if folks are just going on, oh, but they recommended, so this must be right, let me put this in, without doing the necessary functions, tasks, and duties of a coder, we got a problem. Houston, we
But
got a problem.
the problem also that nobody ever wants to talk about is all, yes, this came about because it's supposed to be efficient and ultimately saving money. But what nobody wants to talk about is the number of bad coders out here. You have people who don't know how do you have letters behind your name and you don't know the freaking rules?
I don't know.
I mean, just this week, I had a coder contact me because there was a DRG discrepancy, because she said, well, the path report came back that the person had cancer, that the cells were malignant. But did the doctor say, you can't code for no pathology? Like, what are you talking about?
Yeah,
Why am I telling you that, and you're the coder?
that part. So you're absolutely right.
And if I didn't know, somebody another CDI would have just, well, the coder said that we have to, the path.
Exactly, especially a CDI person who doesn't have any
Exactly,
coding background, who would be like, the coder said
exactly.
it, so I'm going with what the coder said.
And I'm telling you,
Absolutely not.
I see that all day, every day.
Mm, horrible. What'd she say? Because they just wanted to get the letters, nothing else matters, and they want to rush to get A off. You need
Well,
to be able to demonstrate getting A off.
well, they're gonna mess around, and the letters they're gonna get are unemployed.
But they're gonna mess it up for other people, everybody. So to your point, the article that I linked for our discussion today is from the AAPC, and the strategic advantages of third party coding support. Um, Let me just say, because they tried to gloss over it at the beginning of this article, and it's a actual, it's a podcast, I think, that they have, but they actually have it transcribed so you can read. And if AI did that transcription, hence the problem, because there's all kinds of foolishness in the transcription.
Oh,
If
did
you
you see Delve in there?
did, you already know. uh, that's AI's friend. Um, but so AAPC, not only do they have an auditing department, where they are the organization that, hospital organizations or other organizations that need auditing support can call. They are pushing themselves out as an entity, in the game for auditing consulting. Well, they now also have a coding department. So they're putting themselves out there to, um, be a player in, consulting or providing additional resources or additional coders in the event of shortages, staff shortages, or vacancies with vacations or pregnancies or what have you, um, which I feel some kind of way about it for a couple of reasons. I think one, it feels it feels conflict of interest to me. I don't know. It's just something about it just doesn't feel right. Um, Two, we all know, and we've discussed this several times. Are your coders capable to do, especially on an inpatient? Let's talk about inpatient on a pro
Oh,
fee.
please, go ahead. Come on.
On a pro fee, okay, yeah, this has been your bread and butter. But at a hospital level, on an inpatient, y'all wouldn't even teaching guidelines to people. That y'all may have just started to kind of gloss over and get folks into attention into guidelines, but really, I I don't know. And they want to in this article really talk about how um, they stay current with AAPC, their e-blasts. They also mentioned staying current with information that they get from AHEMA as well, and the CMS website and all of that. Um, but are you? I don't know. What are y'all thoughts? What did y'all think if y'all listened to it or read the information, or just thinking or having the thought of, so you are an organization that trains coders, and um and I guess if you think about it one way, like you said, now you're an employment agency, because now I guess you're going to hire these coders to fulfill your coding department for resources to other entities. I don't know. It just some just some just don't feel right in my spirit, and maybe it's just me.
No, it's not just you. What we're really seeing is the dismantling of the coding profession. That's really what's going on.
That's why I said code alert, red alert, red alert.
That's what's really going on, because at the rate that they're going, in about a good 10 years, if they had their way about it, probably if they had their way, it'd be three. But within the next 10 years, you're going to have anybody can be a coder. Because what do you, I mean, they're going to rely on the system to do everything. They're only going to need about 5, 10 people who really have a clue to oversee all the other people who just, you know, kicking the can down the road to somebody who has a clue.
Mm-mm.
And all under the guise of saving money. Oh, and I agree, but they also employ overseas coders, and I have never, ever, ever. I have been working with offshore coders since 2015, and they're just as bad today as they were then, just as bad. But they're cheap, and nobody talks about it, because at the end of the day, it's all about the bottom line.
It's all
They're
about the
saving
money.
money. That's all they talk about. And when I tell you, the word that makes me nauseous is EBITDA. I can't stand it,
Mm,
and that's all they talk about.
mm. Wow. And that's coming from your CFO and your financial
Hmm.
folks.
Hmm.
Oh my goodness.
Because
Wow.
because we have these quarterly meetings, and they talk about all this revenue they brought in, but 10 minutes before this daggone Zoom meeting, I had a headache from somebody 12 hours away asking me about some foolishness in the daggone
Mm,
chart. Why am I still why am I educating a coder? That's not my job. I can do it,
mm,
but are you going to pay me for it?
mm. Lord, Lord, Lord. I don't. So, do they take into account? the back end when you're audited and you got to make repayments? Or I mean, is that not part of the financial conversation? Because again, history has taught us a lot of this stuff can be can be stopped or non-existent if your front end process is solid. If you're doing what you're supposed to do on the front end. Um, so I'm yeah, I'm just
No,
over here baffled.
no,
It's like, oh,
no.
well, we doing this thing, we doing this thing. It's like Oz. You see everything in Oz and everything's good, but right behind the back of the curtain is this little man with some arms and a machine, and you don't see all the foolishness that's happening in the background, which is,
Oh,
yeah, you got all this money coming in, or yeah, you got your claims out and your claims got paid, but these we had to refund all these over here, and there's a possibility we're gonna have to refund some more.
it's just like when you see in movies, like the front end of a restaurant. Oh, it's all moody. They have nice lights. They have nice table linens. But you go back in the kitchen and it's chaos.
Oz. Yeah. And I think that too brings some thought around the whole push for this productivity and to get this stuff out and to move and to it's like it's production. It's production.
Right.
They don't put
And
you out on. They don't make coders part of an assembly line. They don't make the revenue cycle, the majority of the revenue cycle, an assembly line. Or probably all of it. Even
you know,
even the doctors, you get them
and,
in, see them, hurry up, next, get the next one. It's all become production.
and I don't necessarily have an issue with production. I have an issue with unrealistic production because what I know from working from home for a decade, if you don't help hold people accountable, they will do two charts a day. I've seen it. So you
Like,
have
oh,
to
this took all day.
you have to. I have a comment for the meeting after the meeting. I don't want to say it now,
Okay.
but no, you have to have some kind of productivity, but the productivity now is unrealistic
And I
because
think they're using these unrealistic productivities to help drive the conversations and help drive the need for or the urgency for AI or you know AI systems to come in and to save the day, put on their cape. Da-na-na-na-na, here we are to save the day. But yeah, you may get the productivity numbers that you're quote unquote looking for, but where is the quality? The In this game, it's about the quality.
it should be. It should be,
It
but it's
should
not.
be. I mean, hell, from the provider on, because again, we need quality documentation to make sure we got garbage in, garbage out. We need quality in, quality out. I
And
don't know.
in all of this, they never talk about, because here's the thing about AI. When you hear people talk about AI, you never ever ever hear them talk about quality documentation. You never.
No,
Never. And that's where it all starts.
it all starts there.
Because everybody, because what they have done or what they're trying to do is they're trying to circumvent, and they're trying to, because at the end of this, through it all they do is hold everybody accountable except for providers. They don't hold them accountable for their documentation, because how all of this starts with documentation. That's where denials are won and lost, on documentation. Very, very rarely is it on coding. And nine times out of 10, if it comes down to coding, the coder or somebody should have queried the provider before they even submitted that code. That's what probably should have happened. But it still
Mm-hmm.
always circles back to documentation.
Mm-hmm.
And that's until people get a hold of that, and they never will, because in this society, they're never going to hold providers. The only people to hold providers accountable is the OIG when they're suing them. The only people.
And of course, it's like, oh, why you beating up on me? Woe is us. What's your word? Passionate, compassionate sacrifice,
Compassionate sacrifice. Mhm.
and we out here
And
doing the thing, and we're
and
so
I
burnt
don't
out, and
and
all of
and I'm
this.
not one of those people because see first like I realized when I first became a nurse I could never be a doctor because I don't want I value my rest. I don't like my sleep interrupted. They're on call. Like I worked in the hospitals and I didn't had to call doctors 3 o'clock in the morning because somebody then decided they wanted to stop breathing. All of that. It's just
Not
no, no, no,
somebody
no.
decided they wanted to stop breathing. And I get it. I mean, you absolutely right. So it's a whole thing. I mean, no beat up on the providers because they do what they need to do to assist and provide the care for our patients. However, they also have to be mindful and remember while they're doing that. And I know, especially in certain areas, and I'm thinking like emergency where it's just rush, do this, or ICU or those high tense areas. It's a lot of things going on. It's a lot of balls to be in juggle. I get that. Um it's a lot. But you also have to remember that you have to tell that patient's story. You are the only person who can because you are providing the care to that patient. So you got to say, this is what we did. This is how they reacted. This is what we tried. This is how they reacted.
And
Ultimately, this is where they are. It's just a matter of telling that story, which can then provide the necessary revenue back to that department to say, yes, there's value here because they do XYZ for these patients and da 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 da. It's a whole cycle. Go ahead. I'm sorry.
but but just like we have productivity, so do they. Because
They
I
do.
have because I have read notes where some the doctor will order a consult. The consultant will say at the very bottom, discuss the case with Doctor So and So. I'll go to the attending. I'll go to their next note afterwards. Do you think that they changed their documentation? No. So then after I send 2 or 3 queries to try to get some sense so I can assign this admission appropriately. Then they want to go in because then they have to once they answer the query they have to go in and update the records. Now you want to when you could have just ruled it out from the beginning. Like this man said he talked to you about, or this woman said that they talked to you about this person. Either you agree with their finding or they don't. You could just say, agree with Dr. So and so, acute respiratory failure, or respiratory or acute respiratory failure ruled out after discussion. That's not hard.
Mm-mm. And that's your job.
Exactly.
And that's your job.
And
Your
then,
job is to take notes and document
but
stuff because folks are reading what is happening and making decisions based on what is happening and what you're documenting. That's
just,
that's that's medicine all day.
just like yesterday, I had, I waited for, reading those because the patients get ready to get discharged. And I'm like, you keep saying acute on chronic anemia. Why? Why does this person have acute on chronic anemia? Why? You can't have an unspecified what? No, anemia is caused by something. Like, look, say something.
Just frustrating. So I don't want us to I mean, we've brought out some. I think we brought out some valid points, trying to get a grasp of understanding what is happening as it relates to our own coding associations, and the push for both um, AI and having these outsourcing organizations or companies, or in this case departments. But as the coder, I think we've said a few things, but I want the coder kind of to walk away with a solution, or the coder to walk away with something that is tangible for them to think about. One of the things that Mr. Jesse, you said that was really really key and critical is we all know AI is not going away. We all know that the AI we used yesterday is the worst it's ever going to be, because there's always making some type of improvements or tweaking this or doing that. However, we need to really think about, for our own marketability, if you will, what should we be paying attention to now? What should we be focusing on now? Um, if First and foremost, if you are being trained through the AAPC, on the professional side and on the hospital side, understand that the diagnosis is important. Your ICD-10 codes are important, whether you are being paid on them, and ultimately, believe it or not, in some kind of case, you are being paid on it, even though it may be your E&M that you're actually getting kind of the bulk of. There's quality measures. So people are getting additional resources or income based on those quality measures. Um, Most of those are around ICD codes. So again, your diagnosis codes are very, very crucial and important. And knowing how to actually code them is very important and crucial. And knowing the rules, the guidelines, the conventions, all of those things that they may have glossed over in whatever coding program that you are in, it is still important, even on the pro fee side, even in an outpatient side. That information, don't let them tell you, oh, just slap these codes on here and keep going and focus here. No, you slapping codes on and not focusing is impacting in the background, impacting on the back end, not the background, on the back end of this revenue cycle process, which you can circumvent. You can stop that. You can stop that foolishness that happens back there by doing what you need to do, going forward, um, appropriately, the right time, initially putting those codes on and knowing the information and knowing the guidelines and knowing all of the things that you as a coder should know, walking around with certifications behind your name. I understand.
Because what is really going on is you have coders who are pushed to the hilt for production. You have providers who are pushed to the hilt for production. Then you have these people who have nothing to do with anything coming in. Oh, we have this product called AI that can make it easier for everybody. When all the two people who are stressed out have to do is talk about how can we make this easier for each other. Help me,
Amen.
help me to help you.
Amen.
So
Amen.
because they're not having that conversation, these people are coming in with this with
And they're
this.
pitting against each other. Like, so the doctor's like, well, we don't need them. If they messing up, we don't need them. Sir and ma'am, what are you doing? What are you giving us? If you're giving us garbage, then that's what you're
Because
getting out.
the real problem on the HIM side is 75% of the people who are in HIM don't need their jobs because they don't because they don't do their jobs well at all. I've seen it for years. A whole lot of people you need to give them some training, hold them accountable, and either you make the cut or you don't.
Yes.
That's really what it is. I've just seen so many shenanigans go on, and these people are making good daggone money.
Mm-hmm. Yep. Yep. So I hope those were helpful things for you as we, um I can't even say embark on the whole, because we've been here for a minute. So, don't get caught slipping. Know that this is out here. Know that there are possibilities. And never will we say, because I think we all still believe that, there will always be a need for human intervention. You just may not need as many humans to get the job done. So you need to make sure that you are bringing the skills and what's necessary so that you are part of that human intervention number. How about that?
Mhm.
uh, what she say? The constant issue is that there are a lot of HIM title holders. and that's all they are. Yeah, yeah. A lot of people like to see the whole alphabet. That well, I'll, that's
And
funny to me.
and what nobody else is really talking about too, because can we really just talk about this? Look,
Talk about it, sir.
it's,
Talk
it's
about it.
just going to be a messy Saturday because what they need to talk about is these people, because there are a whole lot of exams out here where people got the answers and they just passing them around. These people don't know nothing.
Ooh, ooh. Uh-oh. So my friend took the test and got the answers, and they telling that girl, this is what you need to do, da 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 da. No,
Hmm.
this is what you need to do, da 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 da. So everybody
Hmm.
confused, dumb, don't know the first thing on even what a guideline, rule, book, nothing, convention, nothing is. But we passed the test, and we ready, and we looking for the job. And why can't we find the job? And da 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 da.
Or you get a job and you crash and burn because you can't produce.
Mm. Because you don't know what you're doing. If somebody gave you the information just to pass the test, you don't know this field. You don't know this career.
It
You don't know
it
it.
takes time. Listen, I've been doing this for over 10 years. I still learn. I don't know everything. I
I've been
still
doing
have
this
to
for
look up stuff.
29 and I still learn and
I
I
still
don't know
have
it.
to look up. I still got to
Yes.
research. I still got to collaborate. I
Yes.
mean, honestly, and this is really a shame to say, but I can only talk to one person at my job about anything. One.
Because and it's as easy as just having a conversation like they have no damn clue what they talking about.
And there's no collaboration. You have to have a relationship. Like even as much as some of those, you know, offshore coders get on my nerves. I'll just woosah and I'll just, type my explanation or try to educate them. But when I'm collaborating with a coder that I'm like, listen, how did you get this? Like, where's the documentation? Or, how did you come to this decision? And then we'll have a conversation. Well, I did it based on this. I'm like, okay. And I'll either agree or I'm like, well, we need to get a little more information, you
and and
know?
and the other part that let's put this out there too. Just because somebody questioned you about how you arrived at whatever code or how you arrived at whatever your decision, well, stop being on the defense. Just make sure you like somebody could genuinely just want to know, well, how did you find so and so and so? Where did you get that? I never would have thought to do XYZ. It doesn't have to be an antagonistic kind of situation where, I'm coming for you. No. Somebody genuinely may just want to know. And so why can't we have just a conversation about, oh, well, I just like you said, hey, I found this way, or this is the information that I found in a note, da 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 da. Oh, hey, here's something that's helpful. You may want to check here because I know this particular provider, they don't never put stuff where it's supposed to be, whatever. Sometimes they write stuff over here. That kind of stuff goes a long way. And again, that is part of the collaboration. That's part of the conversation and education and training that a department should have collectively. So what if something happens to that person and that knows that this particular provider documents somewhere where technically nobody would look? No one will ever know that. And then everybody is querying this provider all the time when they're like, I do put it in there. What are, yeah, it may just not be in the place that we're accustomed to looking. And yeah, they do. And so then now there's a whole other battle because then they feel like y'all hanging up on them because you keep querying them about something that they have that they put. But when it could all just be a conversation,
It
just
could
a
all be so
conversation.
simple.
It can all be so simple. I say that
Two
all the time.
two things real quick.
Go
So
ahead.
when it comes to the whole collaboration thing, I always tell my students anything that I tell that I teach you or any answer I give you, I'm supposed to be able to show you how I got it and why it is what it is. Because I tell everybody that I've ever taught, it is not what I say, it's the guidelines. And I tell everybody, I don't make the rules, I just get paid to follow them.
I play by the rules all the time. And if you got some, I don't mean to cut you off, but if you're
Okay.
working with somebody who can't show you how they got that code, and the only way they can tell you how they got that code is through looking at an answer key, baby, baby.
or that's how we've always coded it. That's how we. That's
You done triggered something over here. You may need to rethink some things because they're not. That's not helpful for you.
No, it's not. And then I worked somewhere where I was the auditor, and my supervisor had a problem with this particular provider. And when I first started, oh, he's such a problem. You're gonna have to be careful when you start working with him. He's blah blah blah. So I was reviewing, and when I tell you, his notes were amazing, but it wasn't where she wanted the information to be. You had to look for it. Everything you needed was there, but it just wasn't where it should have been. And I said to her, I said, listen, I said, in my opinion, I don't think that's a fight worth fighting. The
Mm-mm.
information is there. If somebody looked at this record, it would be validated. All they had to do was just look. Like, I don't
Mm-hmm.
think you should try to. Me, when I tell you I had no problem with him, I'm not trying to tell you what to do. He's doing his job.
He's
If I
doing his
if I
job.
gotta read every word of the plan because he didn't put it in the assessment, oh well. That's why I'm here.
That's why I'm
And
here. Similar to
as
the
long
case that we looked at the E&M, like it was there. It's like
as
that
that
simple. Now, because you don't understand medical concepts and understand what labs mean and understand all of that's a you problem. That's some additional knowledge and information and training that you need to go find out in order to assist you to do your job. But don't say it's not there. It's clear and plain to those who have the medical wherewithal to understand the documentation that's being presented, and to try to say that because it's not where you needed to be or you didn't understand what it was that it meant that, oh, they didn't provide that service, is ridiculous. Ridiculous. And they documented the services they provided.
that's all, and that's all they have to do.
That's all they got to do. And Lord knows that's all we really want them to do.
Exactly.
Please just document what you do. So don't come back with them. Oh, well, could you make sure that you make the C this way? Could you cross your T this way? Could you do who? If you don't get away from me, I got my own production I got to worry about. If you don't
Right. I'm like, look, leave that man or woman alone. Let them do what they do.
move on. Right. Trigger statement. That's how it's always done. Exactly. Yes, they triggered me over here.
All right, look, it's 10:12.
All right, we gotta go. We gotta go. Look. We done got excited. But again, I hope that you have received some information here related to solutions around how to market yourself, how to get yourself um, in that number of being one of the humans that is actually needed and part of the team as AI continues to progress and chuggle along in our revenue cycle.
And if you don't, this is your solution right there on the screen.
This is y'all the solution. Come on in and be part of our Patreon. Be part of the tea sippers. Yes, the tea sippers. So, did you know by becoming a patron of ours, you're joining a community of individuals who share a deep appreciation for the intricacies of healthcare revenue cycle? Do you hear the passion? Do you hear it in us? We trying to help you. Be it any and not necessarily just from the coding perspective. This is open for all. We're it's open to providers because there's an opportunity to get information back and forth. It's open to those of us in health information. But here's what you can expect as a valued Patreon and a member of the Tea Sippers: exclusive healthcare insights so you can gain access to in depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access: be the first to receive expert insights and guides, ensuring you stay ahead in the ever evolving healthcare industry, especially as we are in this AI fight. Personalized support: enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth and community connection. Yes, conversations. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So, by supporting us on Patreon, you're not only advancing your healthcare knowledge and career, but also contributing to the success of us all and a resource that empowers healthcare professionals like you to thrive in their roles. So, thank you in advance for considering becoming a member of the Tea Sippers. So, check out the link in the description of the video or patreon.com/Clarice Warner, the girl with the pearls. Your support means the world to us, and we look forward to helping you excel in the world of health information. Yay! So, thank you all again for joining the Saturday morning tea or checking out the replay. Was the tea spilled today? Did you feel some tea? Was it hot? Was it good? Put your teacups in the chat. Let us know that the tea was spilled. So if this information was valuable for you, help us share this message with others by sharing the video and subscribing to the channel. Be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. I will be dropping a couple of videos soon. The 2025 PCS codes have dropped, so be on the lookout for that. Also, be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. And as you leave, don't forget to hit the thumbs up or like button. Also, check out the Coding Nurse channel on YouTube. There's some gems over there as well. Today has been great. Would you agree? Mr. Jesse, you have any
Yeah.
final closing thoughts?
I always say I thank you for creating this space, and people need to come on in, get this information.
Get it while it's hot. Get it while it's hot. So again, see you tea sippers in a minute. We behind, but see you in a minute. So again, thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Have a great weekend and talk to you soon.
Bye-bye.
Bye.